for her 5 minutes of questioning.
Thank you, Mr. Chairman. Republicans on this subcommittee have spent this year burying their heads in the sand as Secretary Kennedy and President Trump decimate this country's ability to prepare for and respond to future pandemics. America needs to prepare to respond to all health threats, whether it's a virus that jumps from an animal to a human or a bioweapon designed using AI by malicious actors targeting Americans. Instead, because of the lies being told by President Trump and Secretary Kennedy, we are becoming more vulnerable to diseases like measles that are preventable and have been practically eliminated from the United States. Dr. Havers, you resigned from the CDC in protest of Secretary Kennedy's unscientific attacks on vaccines, our best defense in the event of a biological threat. HHS has yet to respond to multiple requests from Democrats related to these dangerous policies. Because Republicans have refused to conduct oversight of Secretary Kennedy's reckless behavior, can you please walk us through what you saw happening at CDC that led to your resignation?
So the Advisory Committee on Immunization Practices plays a critical role in establishing evidence-based, science-based vaccine policy for 340 million Americans. With Secretary Kennedy firing that committee and replacing them with people who are ideologically driven, who are not qualified, and who have an anti-vaccine standpoint, I knew that this committee would be weaponized to further spread anti-vaccine propaganda. We would see falling vaccination rates in the population. We would see an increase in vaccine-preventable deaths, and we will see diseases like measles running rampant throughout the population. All of this has happened. I think since I resigned in June, we've seen CDC director resign for refusing to rubber stamp in advance recommendations coming out of this committee. We've seen further loss of expertise and further undermining of CDC's reputation. The fact that Secretary Kennedy hijacked a CDC website and put up information linking vaccines to autism on an official government document was a gut punch to everyone who's ever worked at CDC. That was done without scientific review or scientific clearance. And actions like this have undermined CDC's credibility with state and local health partners, with professional medical societies, and with the public.
So hold on, shortly after you resigned, you said that if Secretary Kennedy's undermining of vaccines, quote, isn't stopped and his policies aren't reversed, quote, immediately, a lot of Americans are going to die as a result of vaccine-preventable diseases, end quote. What consequences will Secretary Kennedy's crusade against vaccines have for Americans, including if we are faced with a pandemic emergency?
So the erosion of confidence in vaccines and the decades of misinformation that Secretary Kennedy and others have been spreading has led to diminished vaccination coverage. We are already seeing pediatric measles deaths. We also saw 280 American children die of influenza last year, the vast majority of whom were unvaccinated. That's the highest level of pediatric deaths since the 2009 H1N1 pandemic. We're about to enter a flu vaccine, a probably fairly bad flu season, and we have tens of thousands of older Americans who die of influenza every year. If vaccination rates drop, confidence is further eroded, and fewer Americans are vaccinated, we will see an increase in unnecessary deaths. In addition, if we have a pandemic and a safe and effective vaccine is developed and is developed quickly and rolled out, I think the lack of confidence in vaccines will mean that uptake will be lower than it could be, and people will die unnecessarily.
So when Secretary Kennedy took office, he claimed that he would bring with him radical transparency, but this administration and Secretary Kennedy's HHS has refused to answer questions from Congress, repeatedly misled the public about what decisions are being made that affect the nation's health, and what evidence, if any, supports these decisions. Dr. Havers, in your testimony, you offer some dire warnings about the consequences of the actions being taken by this administration. I have real concerns that unqualified anti-science individuals continue to be elevated across HHS, including at the FDA, CDC, and NIH. Since Secretary Kennedy has not been transparent, let me ask you instead, is this administration relying on qualified people to make decisions on how to protect the health of Americans?
Absolutely not. The administration has placed numerous political appointees into agencies like CDC, where they're promoting anti-vaccine ideology and are making decisions that are not based on science and that are not based on evidence, and that is leading to dangerous policies that will cost American lives.
Thank you, Dr. Havers. Congressional Republicans have let the Trump administration gut HHS unimpeded. It's deeply disturbing that Republicans have let the chaos unleashed by this administration, which Dr. Havers just described, go unchecked. Thank you, Dr. Havers, for your years of service and for standing up for the health of the American people. With that, I yield back.
The gentleman.